super sick patients. I think I'm gonna do some studying. I am on my way out of here. I apologize for the noise. I'm currently just walking to go get a haircut. It's currently Monday, and as you can tell, I'm not wearing scrubs, and I won't be going into the hospital today because the hospital I work at observes federal holidays, and today happens to be a federal holiday. So got the haircut, got my coffee, got Eleni a pumpkin cream cold brew, and then I just got a drip coffee, so I figured I'd come up to our rooftop since it's so nice out. And the whole reason I got a haircut today was because I'm flying to LA this weekend for my brother's white coat ceremony for dental school. So super excited to see my family and kind of explore LA, go out to eat and do some hiking. So I'm currently on my 3rd week of my CT body rotation. And on this rotation, we read CT scans of the chest, the abdomen, and the pelvis. And for CT chest studies, these are primarily for lung cancer screens or pulmonary nodule follow-ups. And a lot of the abdominal and pelvic exams are for cancer staging. So for example, if someone was recently diagnosed with cancer, oftentimes the oncologists or the surgeons want to know what stage that cancer is, like has it spread to the lymph nodes, has it gone to other organs, has it gone to multiple organs. Some of the types of cancers that I've encountered so far are colorectal, renal cell carcinoma, so kidney cancer, liver cancer, and pancreatic cancer. So I've definitely been learning a ton. And on my 1st week of this rotation, I actually did a presentation on the chapter on the abdomen and pelvis in Branton Helms, which is a classic radiology textbook for R1 or junior radiology residents. So I put together this presentation on the abdomen and pelvis and presented it to my co-residents who are also R1s or PGY2s. Every Friday morning we have this we call it First Year Fridays, where we each summarize and present a chapter in Branton Helms. And this would probably be a good time to plug my Instagram because I post more like day-to-day updates. So if you are more interested in kind of what the day-to-day or week-to-week is of a radiology resident, then definitely go follow me on Instagram. You'll kind of get a feel for what procedures are we doing, what types of scans are we reading, what types of pathology are we learning about, what types of lectures do we have to go to, and that sort of thing. So definitely go follow my Instagram. And yeah, I would say in my 2nd week of this rotation, I already felt like a pretty dramatic increase in my speed. Like for example, in my 1st week, I had a pretty hard time getting through any reasonable amount of studies. But then I started getting a little bit faster and like picking up more studies during my 2nd week. On this rotation, there's no fellows. It's just me and an upper level resident and then the attending. So there's plenty of time for like feedback and teaching. So it's been pretty good so far and I'm definitely enjoying what I'm learning. So anyways, so on the agenda today, I think I'm gonna do some studying and edit some YouTube videos and just kind of take it easy. Maybe get a workout in, maybe go to the lake so I can soak in all this good weather before it gets too cold. And yeah, I'll try to bring you along for the ride this week and bring you all the way to LA. All right, so I'm out here doing some board vitals questions, and I put it on the easy questions, although the easy questions are still pretty challenging for me. There's about 55 of them, as you can see here, and I'm just doing the GI section. So let's go ahead and do a question together. All right, so a 24-year-old female patient presents for follow-up imaging. What's the diagnosis? And it says here the Hounsfield unit of the lesion is -60. So a pretty young patient, female patient. So -60, I'm gonna go with angiomyolipoma. All right, got it right. So if we go to the show explanation, so Hounsfield units for CT scans basically tell us the density of what we're looking at. So this probably has a lot of fat in it, hence the name here, angiomyolipoma. So angio for probably has a vascular component or blood vessel tissue, and then myo for muscle or like muscle tissue, and then lipoma is for fat tissue. So yeah, what we're seeing is kind of macroscopic fat within a angiomyolipoma, and it's saying it's a disorganized proliferation of vascular, smooth muscle, and lipid tissues within the renal parenchyma. Benign entity, no metastatic potential. That's good. They do have a tendency to bleed, it says here, due to their vascular component, so that makes sense. So angiomyolipomas are also a component of tuberous sclerosis. So in this disease, you have angiomyolipomas and pulmonary lymphangiomyomatosis and cardiac rhabdomyoma. So there you go. There's some radiology for you. So yeah, I didn't think it was going to be like cancer in a patient that young, especially when they're giving you the Hounsfield units. They probably want you to hone in on a certain type of tissue. So I went with fat. morning, everyone. It's now Tuesday, and first thing I do when I get to work is basically do all the protocols. Protocoling means that we go through the studies and make sure that they're ordered correctly. So of course you can have a CT scan of the chest, CT scan of the abdomen and pelvis, or just the abdomen, or you can have a CT cap, like a chest, abdomen, and pelvis, and all of these can be ordered with contrast or without contrast. It just depends on what the clinician is looking for. Like, is this a lung cancer follow-up, or are we looking for something else? So the exams can be ordered differently. For example, we can do a low-dose CT scan that has a significantly lower dose of radiation. If we're looking for pulmonary nodules, for example, we'd also do a urogram or enterography, and there's many different types of imaging studies that can be ordered. So my job as an R1 is to go through all the protocols and preview them and kind of order them the way that they should be. Sometimes patients have contrast allergies, so we might have to pre-medicate them. We also look at a patient's creatinine and GFR, which are markers of their kidney function. So sometimes we have to hydrate the patient before we give them contrast. So those are some of the things that we think about when we go through in protocol. Anyways, I'm gonna get back to work and I'll catch up with you guys later. As you can tell, it's a little overcast, but if I show you back here, there are some blue skies. But yeah, that wraps up Tuesday. I picked up cases involving SICU and MICU patients, so super sick patients. Tomorrow we have core lecture from 7:30 to 11, and then we go back to clinical work. So this week is gonna go by super fast. All right, so I just wrapped up for the day, about to head home. In the morning, we had core lecture on MSK radiology or musculoskeletal. And we also had an hour-long lecture about joint injections. So that was really nice because I'd never had really kind of structured didactics about procedures like that, especially joint injections. So that was pretty nice. Then went back to work, read a CT scan, and then we had noon lecture again. And then in the afternoon, I staffed out with one of my favorite attendings. And I just love working with this attending because he's always playing music when he's in the reading room, and he does a lot of one-on-one viewbox teaching, so that's super nice. And yeah, saw some interesting cases, and that is it for today. So I just called in to pick up some pizza for dinner because we're going out of town this weekend. So pizza for dinner tonight, and I am on my way out of here. Our noontime lecture was about physics, so that stuff went right over my head, but one day I'll understand it, or at least pretend to understand it. And yeah, that basically wraps up things for today. So I'll leave it there and check back in when I'm in California. And I guess since you're probably about halfway through watching this vlog, feel free to leave a comment below, just letting me know kind of how you like these vlogs. I'm obviously not like skateboarding like down New York City with like, you know, the whole vlog setup with like a huge expensive camera like Casey Neistat or anything. But vlogging is pretty fun, so I see the appeal. All right, so I'm not exactly sure where I left off the video, but it's Monday now, and I just finished work. And instead of me telling you about how much fun I had this weekend, I figured I'd splice together some clips and show you instead. that basically wraps up this week in my life. I hope you liked the video. And if you did, I would love to hear from you in the comments below. As every YouTuber says, don't forget to smash like, subscribe button. Don't forget to follow me on Instagram and TikTok, where I post more about radiology, medical school, and residency. And I guess I'll see you on the next one. Peace.